Hello, Liz. How are you? Welcome to the Health Tech with Purpose podcast. How are you today?
Very well, thank you. How are you?
Yes, doing great as well. And I was really looking forward to this podcast episode because, I had been following Orcha Health since some time, and you guys are doing some fantastic work. So, finally, able to meet the heroes behind the whole company. Let's get started right away.
Yeah, please. That sounds great.
Great, great. So, to our viewers, why not you start with a bit of introduction about Orca Health, what do you guys do, and also a bit more about yourself. Let's start with those questions first.
Of course. My name is Liz Ashall-Payne, and I'm the founding chief exec at Orca. I started my work in healthcare nearly 25 years ago when I trained and started working in complex pediatric care as a clinician. And for me, 25 years ago, my big passion was I wanted to help people. And of course, I was really excited about my first day in clinic when I started to see patients. But at the end of that first day, felt really frustrated because I'd only been able to see 6 patients. And I knew that there were a lot of patients waiting for access to my knowledge and support and interventions. And that started my passion and frustration, which is how can we provide more access to healthcare for more people? Now, this was before we had access to technology. So I didn't have a computer on my desk, and I certainly didn't have a smartphone in my pocket. But I got interested in lean methodology, quality improvement, stripping out waste so that we could release time to care. And we did some really transformational things right across the NHS in most types of health and care services that you can imagine. But of course, you can only run so fast. And that's when you need to start to look at innovation and new ways of working. And it was around about 10, maybe 12 years ago that technology really started to emerge as an enabler to enabling us to do that. And of course, the smartphone was born, and we all started to use smartphone devices for lots of different parts of our life. We also started to see the rise of digital health and health apps. So around about 30,000 health apps were available to us. And I just thought very simplistically, if everybody has a smartphone and we have lots of health apps, why don't we just put the two things together and we can all have access to healthcare whenever we need it? But of course, it's not that simple. Fast forward a few years, and I started to work internationally, working across Europe and North America, supporting system leaders to think how they could use digital health to better improve population and patient health outcomes. And what I saw was some of the real barriers to adoption. At this time, there was about 165,000 health apps, so it had massively accelerated, and we were missing the opportunity. And there were a few reasons for that missed opportunity. The biggest reason was trust. People didn't know which technologies they should trust. And you fast forward another few years, and where we are now, and we have access to 365,000 technologies. And Orca have completed nearly 25,000 assessments and evaluations of those technologies. And our research is showing that only around about 20% meet the quality criteria that you would expect. But what we also know is that every day 5 million people download a health app. And so for those 5 million people, most people are finding unsafe, unregulated technologies that shouldn't really be used. And so we've got a massive missed opportunity. Now, there are lots of other problems in the adoption of digital health, and I basically got obsessed with those challenges and thought, well, how can we resolve these challenges to embrace the opportunity? And where else in healthcare are we distributing interventions safely and effectively? And the obvious thing to think about is drug distribution. So we've all been prescribed a drug. But before we get prescribed that drug goes through a licensing process to make sure that it's safe, to make sure it's effective. That's about building trust. Would-be prescribers are then trained in these drugs. It forms part of the curriculum. So not everybody can prescribe a drug. You have to be a prescriber. We then have in the USA, you have the Orange Book. Here in the UK, we have the British National Formulary, which is a book that tells you about the drugs and the contraindications. And then we have a prescription infrastructure that allows a doctor to prescribe a drug to you or to a patient. And that's about tracking where the drug's gone and following reimbursement. And that was the basis for the founding of Orcha. And what we do at Orcha is we evaluate technologies. We then distribute that information into training and workforce development. We then create bespoke digital health formularies so that would-be prescribers of technology can search, view, and understand any risks or side effects, and then prescribe it by a text message to their patient. Now, what we also do is we don't evaluate just once. We continuously reevaluate, because once a technology has been prescribed, you need to know what technology's gone where, and if a future fault is found, you need to be able to recall it. And so we started our work in the NHS, and I'm very proud to say we now work in 13 different countries across Europe, the Middle East, North America, and Australasia.
Okay. Okay. So that's pretty much the whole world. Most of it.
Not quite yet, but we're gonna give it a go.
Right. Great, great. No, definitely, it sounds so much responsibility that you guys have taken up. Just like the analogy that you use, that there is that whole checking up for drugs, but then for technology, while hundreds and thousands of applications are actually added to the Play Store every day. There is high chance that not all of them are really as good as they claim, and could actually like be problematic for the end user. So go deeper with this list, especially about like what kind of checks that you guys do, what makes you approve or not approve these apps, and any frequently found things or any frequently found issues that have led to app failures, that you see like red flag. If this happens, you already know where it is going.
Yeah, of course. So it's quite a complex area. So I'm going to try and describe it in a high level point. But if anybody who's listening is interested, we can provide volumes of data and information on this topic. So do reach out. Now, the first thing to say is that globally, we've started to see the rise of digital health assessment frameworks. And this is basically the coordination and compiling of regulations, compliance, and best practice standards that have come together into a list of criteria. And the idea is that if you meet this criteria, that jurisdiction can trust you. Now, it might even be state by state, as is the case in America, but all of these different bodies or jurisdictions have standards and compliance requirements. Now, what we do, because we work in lots of different countries, is we've horizon scanned globally all the compliance requirements. Predominantly, they fall into 4 buckets. The first is data security. The second is data privacy. The third is clinical and professional assurance. And the fourth is user experience and accessibility. Those are the 4 big buckets. And globally, when you look at requirements for digital health technologies, there are quite a lot that are the same. So in fact, the majority of questions that people are trying to answer are the same. And that's because there's only so many questions you can ask of a digital health technology. So what we've done at Orcha is we've coordinated that into an international baseline. The international baseline assessment process is basically around about 70% of any digital health assessment framework. So we do the underpinning evaluation across those 4 areas, looking at the questions that everybody wants to know the answer to. Now, of course, there are some really basic fundamentals in there. A very simple example would be, is this technology a medical device? If it is, does it have relevant certification? If the answer is no, we need to stop the evaluation, because there is no point in going on to understand, is this technology HIPAA compliant or GDPR compliant if it's not got this basic underpinning fundamental. So we take technologies through a process of gateways for compliance. What we then do once they've achieved the international baseline is we then say, okay, which vertical, which area or market are you interested in working in? So here in the UK, the NHS has something called the DTAC. And the DTAC is their digital health assessment framework. So 70% is covered on the international baseline. And then there are some additional criteria, which is very specific to the NHS around clinical safety and data security predominantly. Now, technology then goes through those additional requirements, and then they get DTAC approved. And this is an ongoing compliance. Now, what's really interesting is that additional requirement, we're also starting to see convergence. So the clinical safety element, which started and was born here in the UK within the NHS, has also now been adopted in New Zealand. And it's also starting to be adopted in other countries. And so what we're seeing is more of a convergence at that enhanced layer. Now, you asked a question about fundamentally what are the areas that people are missing. And of course, what we're talking about here is health and healthcare. But we as end users and as systems are nervous about things like data security. What's happening with my data? Where is it going? Where is it being held? Am I consenting to share it? So all of that has to be taken into consideration. And of course, if a technology interoperates and shares data into clinical environments, that's another set of questions that we need to ask. And then, of course, within healthcare, there's lots of requirements around clinical and professional assurance. So I talked about clinical safety, but of course, further to that, clinical evidence of effectiveness is absolutely critical. So a product might be safe, but is it going to actually do what it says it's going to do? And then the final thing I'd just say is, of course, not all these questions are relevant to all digital health technologies. So there are a whole spectrum of risk when we talk about digital health. So at one end of the spectrum, you'll have a digital therapeutic, which may diagnose you. So it may be a mole tracker that scans for skin cancer. That is a highly complex, highly regulated product. At the other end of the spectrum, you might have a digital recipe book, which is basically the equivalent of a book in an app. Low risk, doesn't hold data, push data, share data, is not clinically of risk. And so the way in which you assess and apply the criteria also has to be proportionate.
Okay. So how does this typical assessment, when you would do, like what kind of team composition ideally is there, and how long does an assessment takes, if you can share more about that? And let's start with that, then I have a part B with this.
Sorry, no, that's absolutely fine. So I talked about the gateways. Now the first thing is, how do we pick which technologies to assess next? Right. So we work with lots of government bodies who ask us to assess and evaluate technologies, to check them before they engage with them. We also work with a lot of the different parts of the healthcare system globally. We also get asked if we can assess technologies to make sure that they're compliant. We also get asked by the suppliers. So the digital health technology suppliers, they want to know, have I made this product meet a market requirement? So they'll come to us. But we also have investors come to us. Anybody who's got an accelerator, they want to know and check, are we backing the right technologies that are safe and effective? Right. So we have people coming to us, but we also go out to the marketplace. And what we do is we do a global data scrape every single day. And that global data scrape, we bring in information about the world of health apps and digital health and digital therapeutics. And we're looking at what's new to the market and what's been most downloaded. And if we have any capacity to do additional assessments, we will assess the most highest downloaded technologies. And the reason for that is because if people are using them, we need to know if they're safe. So that's the first thing to say. The next thing, and that's all very heavily from a data perspective. The next thing to say is we've built a review engine, and that data then goes into our review engine. So it's still a manual process, but we've built technology that enables us to assess proportionately and repeatedly. And so when a technology first comes in, we're looking at what does this technology do, what functions and features does it have, and what risk profile does that mean? So I use the two examples. Of course, on a diagnostic that interoperates its data, all the questions open up. On a digital recipe book, we're asking a lot less questions. So the time is directly correlated to the risk of the product. But then what we do is we'll take it through these stages. So the first stage is a rapid assessment, looking at basic fundamentals. That process takes about 30 minutes. And if a product hasn't met that, we stop and contact the supplier and advise them on gaps. When they update and change, we will then proactively take it through the next level. The next level is then the international baseline, and that, depending on the product's functions, features and risks, can take up to 3 hours to do that second level. Now, what we have are human people reviewing technologies and still handing off to experts, but we only hand off to experts for the bit that they're expert in, and they then feed that information back into the review engine. The final section, it then depends on the jurisdictional requirements. So the DTAC here in the UK then takes us an additional day to complete. Now, quite often there is some back and forth with a supplier because quite often there'll be gaps. And the reason there are gaps isn't because anybody wants to not be compliant, it's because they didn't know what the rules were in the first place. And so what we do is we're continuously feeding back gap analysis, and then the supplier will say, okay, we've now completed that, and on we go. So the lagged time can be a much longer process.
Okay. So tell me more about the business model that you have around here. Like, for these studies, are organizations or like healthcare organizations or hospitals are your biggest customers who would ask you to assess, or would these be companies that are looking to build a product, they come to you to get it assessed? And if these are companies, then at what stage they usually come in? Would they come at an early stage so as to course correct themselves, or would they usually come when they've already launched and now they want to go enterprise or something?
Yeah, no, really good question. So we have three basic offers. The first is Orcha Assure. So this is when we're testing and evaluating technologies. We have a number of different partners that we work with. So as I said, government bodies, the suppliers, healthcare systems, employers. So anybody who wants to check if a product is safe, they can come to us and we will engage with them. We also do quite a lot of that work in life sciences now because Big Pharma is really interested in this space. So that's the first thing, the Orcha Assure. The second thing we do is then the Orcha Activate, and this is the creation of digital health libraries, formularies, and engagement with the workforce. Predominantly, this is working with healthcare providers. So a healthcare provider who have a population that they want to distribute great technologies to. And we work with the teams, the doctors, nurses, therapists, to train them and provide them with the infrastructure to be able to pick and prescribe the technology to that patient. And then the third thing that we have is Orcha Insights. So we have really unique data about that world of digital health, how it's changing over time, what technologies are compliant according to which areas, what technologies are being picked and prescribed, what's the conversion rate, and how is that changing over time. And who's interested in that? Well, for a start, we're interested in that at Orcha because we then use that data to feed research. And that's because there's still a lot of questions in this space. But also other people are interested in this data. So we work with regulators, for example, who want the data about what's compliant and what's not compliant. But we can also work with healthcare systems who say, oh, we're interested in engaging along a cardiovascular disease pathway or a diabetes pathway. What's out there? How is the world changing? What's the size of the opportunity? And which technologies are doctors most engaging with? So the Orcha Insights piece is quite interesting. We've worked with a lot of research organisations, regulators, again, life science and big pharma, healthcare systems, and digital health suppliers, because they quite often want to know what's different about my product and what's the competitive landscape.
Mhm. Makes sense. Makes sense. So, Liz, from here, I'd like to change gear a bit more on Liz, the leader. So, Liz, can you share with us more about, like what inspires you, in being in health tech, and then some of your own, stories or anecdotes that you would like to share that may have happened at Orca or from your past experiences in healthcare too.
Yeah, of course. So what inspires me? So we all get asked a question when we're about 16 or 17, and that question is, what is it you want to be? And you're normally at school, and somebody at school will say, what job do you want to do? And it's a really tricky question. I've got a 17-year-old. He's been asked that question all the time. And I had no idea what job I wanted to do. But I knew fundamentally what I was interested in and what my passion was. And that's still the same today. My passion is I want to help people. And that was naturally why I got interested in working clinically. But of course, what I've seen over time is that we can help more people by doing things differently. And as a clinician, I can only see one patient at a time. Whereas what we're doing now, distributing safe technology, we can help millions of people all at the same time. And so that's my big passion. And of course, right now, healthcare systems across the world are really struggling in crisis. We see the post-pandemic challenges around mental health. More people are experiencing anxiety, stress, depression. Waiting lists have skyrocketed. The impact on healthcare systems for people who are attempting suicide and self-harm. And actually, there are lots of amazing technologies that we can get to people right now to help them immediately while they're waiting or struggling or in crisis. So that's a use case. But of course, another example would be people waiting for elective surgery. And those people are waiting for operations, and they might be in pain, or they might be not sleeping well, or they might not be exercising. Let's provide these people with technologies to get them as fit and well as possible for that surgical intervention, because post-surgery, they're going to have better health outcomes. But that's also where digital health can help. So rehabilitation, we don't have enough physiotherapists and occupational therapists. And of course, even if you've got access to a physiotherapist or an occupational therapist, it's likely to be once a week. Well, what about all the other time? Well, a digital health package can help, and you can have access to your interventions on your phone when you need it. And so you can hear I'm really passionate about wanting to help more people have access to healthcare when they want it and when they need it. So that's my underlying passion.
Okay, great. And I think that is definitely that passion really is required, whatever you do. If you know your passion, everything else becomes like a journey to that passion, and you don't feel
Absolutely.
overwhelmed with the challenges that you would otherwise face. Right. So, since you had so there was a part B to my question, which I'd like to remind that, since you had this experience of working in health tech in various roles and in various companies, and, you have such an accomplished career. So, any learnings or anecdotes that you'd like to share, especially for young health tech professionals, those who are, getting started, those who are seeing digital health right from day one, and seeing like how things are changing, probably seeing generative AI today as a solution, as they start. So share some wisdom, please.
Yeah, sure. Yeah, no problem. So I've had lots and lots of lessons learned, and I'm sure I've got plenty more to come, which is part of the excitement of the journey, learn every day. I think that my first lesson is if you want to get involved in this space, you have to have passion, and you have to be really clear about the problem you're trying to solve, and you have to fall in love with that problem, because that is the passion and the drive that will get you up every day so you can work towards a solution. But don't get wedded to the solution, get wedded to the problem, because your solution will keep changing. So as you've just described there, new opportunities are emerging around AI, for example. When I started, AI wasn't even a thing. So the problem that I'm trying to solve is, how do we help more people have access to healthcare through digital? And now we have the opportunity to feed AI into that. If I got wedded with the solution, I would never change the solution. So get obsessed with the problem and get really passionate about dealing with the problem and driving that forward. My second lesson is find amazing people to work with. You can't be great at everything, and be honest with yourself about what you're brilliant at and what you're not. And then find people who are brilliant at the things you're not good at, and so that you can work collaboratively. And that's another lesson, which is always work in partnership. You know, we get asked a question quite often, who are your competitors? I don't see that as a reality. Anybody who's interested in this area, who can help us achieve our mission of improving lives to achieve sustainable healthcare for everybody, I want to work with them, whether they're doing the same thing or not. And so collaboration is king, and working with different parts of the system to really solve that problem. And then I suppose that I'm just going to say two other lessons. As I said, I've got a lot of lessons. One of the lesson is all about resilience. So you'll have days which are really difficult. You'll have weeks that are really difficult. Sometimes you'll have months that are really difficult. That is unfortunately life. But how do you build resilience? And for me, I have an analogy that I use, which is that of a waterfall. So I'm really fortunate. I live very close to the countryside, where there's lots of lakes and streams. And when I walk, I quite often see small waterfalls. And when you look at a waterfall, the waterfall is very turbulent. It's fast body of water that's coming over, and it can feel like that sometimes in work and life. But the thing to recognize is that after that waterfall, there is always an after the waterfall. And after the waterfall, it is calm again and deeper. And that's because you learn most when you go through turbulent times. And so when I'm going through a turbulent time, I know that it will end. I don't know when it's going to end, but when it does, it will be calm again and the water will be deeper. And then I suppose my final lesson is be really grateful and have I've got massive amounts of gratitude. Gratitude for the people I work with, gratitude for being able to try something different, gratitude for the partners and the collaborators and the people we work with. And I think being really grateful again helps you to build resilience and then focus on what needs to happen next.
Right. And I believe that, in the bigger scheme of things, all the lessons that you said, are valid, and then they eventually all connect together, when you basically have that passion and, you do that every day and you start seeing those dots connecting. So resilience and courage and, yeah, everything basically starts connecting together. So thank you so much, Liz. This has been really a masterclass, and so much wisdom that you've shared with us. So really good, and thank you so much for taking up the time.
No, thank you for inviting me. It's my pleasure.